Good afternoon. Today's post-conference is brought to you by precedex. Precedex, a sedative hypnotic otherwise known as dexmedetomidine. Precedex is indicated for sedation of initially intubated and mechanically ventilated patients during treatment in an intensive care setting. Precedex should be administered by continuous infusion not to exceed 24 hours. Precedex has been continuously infused in mechanically ventilated patients prior to extubation, during extubation, and post-extubation. It is not necessary to discontinue Precedex prior to extubation. It is also used for sedation of non-intubated patients prior to and/or during surgical and other procedures, aka procedural sedation. Precedex clinical pharmacology. Mechanism of action. Precedex is a relatively selective alpha-2 adrenergic agonist with sedative properties. Both alpha-1 and alpha-2 activity is observed following slow intravenous infusion of high doses or with rapid intravenous administration. Pharmacodynamics. In a study of healthy volunteers, respiratory rate and oxygen saturation remained within normal limits, and there was no evidence of respiratory depression when Precedex was administered by intravenous infusions at doses within the recommended dose range of 0.2 to 0.7 micrograms per kilogram per hour. Pharmacokinetics. Following intravenous administration, Precedex exhibits the following pharmacokinetic parameters. A rapid distribution phase with a distribution half-life of approximately 6 minutes and a terminal elimination half-life of approximately 2 hours. Precedex is mostly metabolized by the liver and excreted in the urine. Precedex dosing should be individualized and titrated to desired clinical response. Precedex is not indicated for infusions lasting longer than 24 hours. And of course, Precedex should be administered using a controlled infusion device. I know you're all wondering, how do I prepare Precedex for administration? Well, parenteral drug products should be inspected visually for particulate matter and discoloration prior to administration whenever solution and container permit. Precedex injection is supplied as 200 micrograms in a 2 ml vial. Precedex must be diluted with 0.9% sodium chloride injection to achieve required concentration of 4 micrograms per ml prior to administration. Preparation of solutions is the same, whether for the loading dose or maintenance infusion. To prepare the infusion, withdraw 2 ml of Precedex injection and add to 48 ml of 0.9% sodium chloride injection for a total of 50 ml. Then shake gently to mix well. Can Precedex be given with other IV fluids? Why, yes. Precedex has been shown to be compatible when administered with the following intravenous fluids: 0.9% sodium chloride in water, 5% dextrose in water, 20% mannitol, lactated Ringer's solution, 100 mg per ml magnesium sulfate solution, 0.3% potassium chloride solution. Is Precedex compatible with blood products? No. Precedex infusion should never be co-administered through the same intravenous catheter with blood or plasma because physical compatibility has not been established. Does Precedex interact with any drugs? Why, yes. Precedex has been shown to be incompatible when administered with the following drugs: amphotericin B and diazepam. Also, co-administration of Precedex with anesthetics, sedatives, hypnotics, and opioids is likely to lead to enhancement of effects. When considering giving Precedex in ICU, it is helpful to know that dosage for adult patients needing a loading infusion is 1 microgram per kilogram over 10 minutes. For adult patients being converted from alternative sedative therapy, a loading dose may not be required. For patients over 65 years of age, a dose reduction should be considered. And for adult patients with impaired hepatic function, a dose reduction should be considered. Are there any contraindications for Precedex? Nope. But remember, people with hepatic impairment and over the age of 65 may need less. There are some warnings and precautions you should be aware of with precedex. Clinically significant episodes of bradycardia and sinus arrest have been reported with precedex administration in young healthy volunteers with high vagal tone or with different routes of administration, including rapid intravenous or bolus administration. Reports of hypotension and bradycardia have been associated with precedex infusion. If medical intervention is required, treatment may include decreasing or stopping the infusion of precedex, increasing the rate of intravenous fluid administration, elevation of the lower extremities, and use of pressor agents. Because precedex has the potential to augment bradycardia induced by vagal stimuli, clinicians should be prepared to intervene. The intravenous administration of anticholinergic agents, for example atropine, should be considered to modify vagal tone. In clinical trials, atropine was effective in the treatment of most episodes of precedex-induced bradycardia. However, in some patients with significant cardiovascular dysfunction, more advanced resuscitative measures were required. Caution should be exercised when administering precedex to patients with advanced heart block and/or severe ventricular dysfunction, because precedex decreases sympathetic nervous system activity. Hypotension and/or bradycardia may be expected to be more pronounced in patients with hypovolemia, diabetes, or chronic hypertension and in elderly patients. In clinical trials where other vasodilators or negative chronotropic agents were co-administered with precedex, an additive pharmacodynamic effect was not observed. Nonetheless, caution should be used with such agents administered concomitantly with precedex. Transient hypertension. Transient hypertension has been observed primarily during the loading dose in association with the initial peripheral vasoconstrictive effects of precedex. Treatment of the transient hypertension has generally not been necessary, although reduction of the loading infusion rate may be desirable. Arousability. There's some claim that patients aren't really sedated with precedex. And in fact, some patients receiving precedex have been observed to be arousable and alert when stimulated. This alone should not be considered as evidence of lack of efficiency in the absence of other clinical signs and symptoms. Can patients withdraw from precedex? Well, with administration up to 7 days, regardless of the dose, 5% of precedex adult subjects experienced at least one event related to withdrawal within the first 24 hours after discontinuing the study drug, and 3% of precedex adult subjects experienced at least one event in 24 to 48 hours after the end of the study drug. But the most common events were nausea, vomiting, and agitation. In adult subjects, tachycardia and hypertension requiring intervention in the 48 hours following study drug discontinuation occurred at frequencies of less than 5%. Though if tachycardia and/or hypertension occurs after discontinuation of precedex, supportive therapy is indicated. In procedural sedation patients, withdrawal symptoms were not seen after discontinuation of short-term infusions of precedex of less than 6 hours. Tolerance and tachyphylaxis. The use of precedex beyond 24 hours has been associated with tolerance and tachyphylaxis and a dose-related increase in adverse reactions. For those who are wondering what tachyphylaxis is, it is a medical term used to describe an acute decrease in the response to the drug after its administration. Is there evidence of drug abuse and dependence with precedex? Well, precedex is not a controlled substance, and the dependence potential of precedex has not been studied in humans. However, since studies in rodents and primates have demonstrated that precedex exhibits pharmacological actions similar to those of clonidine, it is possible that precedex may produce a clonidine-like withdrawal symptoms upon abrupt discontinuation. And just a little FYI, Precedex average wholesale price is approximately $55 per vial. For comparison, a 5 mg vial of midazolam is approximately $5. The end.